So this video is going to take a look at multidisciplinary working, or working in partnership, or multidisciplinary teams. But essentially the idea of multidisciplinary working or a multidisciplinary team is to have a health and social care cooperative group working together, so different professionals from different backgrounds performing different roles within an individual's care plan, essentially bringing their own expertise, their specialisms and their skills to work with one patient. So teams within a multidisciplinary approach may include health and social care organisations, but it could also include voluntary organisations or charities. You may even find emergency services such as the police or education services being represented in a multidisciplinary team if that multidisciplinary team is centred around a vulnerable person or possibly even a younger person. So the need for joined up working when it comes to healthcare is really important. So if a service user is known to and supported by lots of different agencies, lots of different professionals, then essentially those people can work together as a team. They can bring their own cases into this team, they can bring their experiences, and also it's really important, particularly for quite serious cases of abuse, neglect, that if information is being shared, it means that there's a greater source of evidence, greater picture of what's going on, and that can lead to better intervention. There have been a number of very high profile child abuse cases, children's deaths, where a lack of joined up working has been identified as one of the reasons that ultimately led to those children's deaths. And I'll mention an example of that in a little bit. So the main benefits of a multidisciplinary team, if you get a multidisciplinary team together, the main thing is that those professionals are working together. They're meeting the need of the client. The professionals can bring their specific skills, their abilities, and also their specialisms, and they can focus on the area that they are the best suited for. So a physiotherapist will focus on providing exercises, treatments, mobility support, while a pharmacist might focus on providing the medication that together will assist a patient recovering from a surgery like a knee surgery or some kind of hip replacement. This means there should be no gaps in care and a greater range of needs are being met. If the care is planned properly, then resources aren't wasted, it's cost effective and it's very efficient, and there can be no gaps in the service. And also it means that the service users don't have to go and tell half a dozen different health professionals what is happening, why they're seeing them, or what support they need, because effective communication between the different agencies means that information is being shared regularly. So that could be really helpful for dementia patients, patients with Alzheimer's, or maybe even just elderly patients who may be confused, not having to explain their story every single time they encounter a new professional. However, the downsides of a multidisciplinary team is that there might be some professional rivalry, jealousy, or conflict between agencies. You might still find there's poor communication and that information isn't shared or updated, whether that's poor service or poor practice or even just human error. Service users can manipulate the service provider. So again, you might find a user pitting different agencies against each other, commenting to one, maybe not to another. There could be conflict over funding, so who will provide particular sources of funding, treatment or services. There might even be conflict over responsibility, so again, who takes primary care, who takes the main responsibility of supporting a patient or a service user. Different agencies might use different IT systems, different ways of recording data, which again could lead to poor communication or ineffective sharing of information. And if there's a delay in one service, that could impact another. So if there was a delay in an occupational therapist assessment, that could delay the release of a patient into a care home, that could delay a social worker, support worker putting a plan in place. So it could cause this chain effect. Now, for a multidisciplinary team to be effective, as the strengths kind of suggest, if information is shared and all relevant information is shared, Regular meetings take place and are fully attended by all the agencies working with an individual. If they're following the policies and procedures, they're following concerns, and there are opportunities for whistleblowing, this again makes a team more effective. Organisation is always a key to effective working, and as we mentioned, full participation in reviews and working collaboratively. And the end goal of a multidisciplinary working approach is if you get everyone working together effectively, then you are providing holistic care. You are meeting the physical, the social, the emotional, the spiritual needs of an individual. So it's kind of your pies plus an extra S. And you're addressing them as a whole person. You're not just focusing on one issue, you're covering all their needs. This also is really important if you think about other areas like empowerment. If you're meeting their needs, you're promoting independence, you're providing support, you're going to empower the patient, they're going to take on more responsibility for their care. There's less learned helplessness and reliance on the support. Now, as a famous case of multidisciplinary working failing, you could look at the cases of Baby P. Again, one of these very horrific cases. It was kind of followed on from the death of Victoria Climbié, which was a very similar case in which multiple agencies were interacting with the victim. They were identifying different concerns, different risks, different injuries, different issues with each interaction, but because there was not effective sharing, there was no collaborative working, pulling all these bits of information together, they put all these bits of puzzle together, they would have the full extent and this very horrific circumstances which the little baby found himself in, and they would be able to intervene much more effectively. And you never know, that it could have prevented Baby P's death. Same in the case of Victoria Climbié. If this sharing of information had been more effective, that ultimately could have prevented possibly the death of this child. So again, this is just a kind of adding a little bit of kind of gravity to this, that if these services don't work well, you know, the worst case would be the death of a service user, a patient, a vulnerable person, a child. And this is why it's so important to have good multidisciplinary working. Now, in the exam board love multiple disciplinary working questions. 8 markers on multidisciplinary teams have come up very frequently in the exam. And just to show you just 5 previous question examples, so you can see how multidisciplinary working can support Leiden, how multidisciplinary working can support Tom and Linda, how multidisciplinary working can support Jake and his father, how it can support Nikki, and the last one there, advantages and disadvantages of partnership working, which is just a different way of saying multidisciplinary working. So you can see this is a question the exam board tends to use frequently, and often it's an older person, potentially with a health condition, Alzheimer's, dementia, and again you're pulling services together, or with the case of Nikki with Jake, it's someone with a learning disability, and I think with Leiden it was a physical impairment that was the key source. But you can see a very common question. The exam would like to use this as an 8 marker. Now, just to look at one example of an 8 mark answer, the question I mentioned before about Tom and Linda. And what I've got here is an student answer for this question. Now, this is a very high scoring student response. The exam board wanted to see things like joined up working with the service partners, ways that Tom and Linda could have an advocate to support them, holistic care, the reduction of any gaps in their service, different specialists providing support, legislation being followed. You can see very clear benefits, as we mentioned earlier in the video. And if I just show you my kind of marking of this essay, just to see where they've picked up the key marks, in my opinion. So hopefully this makes sense, and I'll explain what I've done here. So I've tried to color code and break down their answer into different arguments, different points that they've made throughout the response. So you can see they start off early with the definition, just saying what a multidisciplinary team is. They then go into their first strength. They've identified a strength, which is effective support and information being provided to Tom and Linda. And then they go on to explain what that does, how that supports them. So different professionals, organisations bringing their knowledge to ensure Tom and Linda can make decisions and they're empowered. So they've made a point and they've explained it. The second one, again, multidisciplinary working is effective because it provides a holistic approach. You know, they're treating them as a whole person rather than just a medical need. So a point and an explain, just your kind of first point and explain for 2 marks, second point and then explain for us another 2 marks possibly. They've got a third reason, which is about Tom and Linda don't need to repeat information, as we mentioned before. Again, that supports them because it speeds up care packages. They talk about multidisciplinary working providing respite care for Tom, and they talk about domiciliary carers, a little bit of a break for Tom and Linda, and again helping them to meet everyday routines. So as you can see with this answer, they've given 4 reasons for why multidisciplinary working would benefit them. They've given 4 explanations of why it's also important to help. You can see, as I've highlighted in red, they are frequently referencing Tom and Linda, and there are a couple of cases where their explanation of what support's being offered to Tom and Linda is very specific to the case. So talking about the respite care towards the end to give Linda a break from looking after Tom, very specific to the case. A couple of the others you could kind of do the what I call the Karen test, where you could just switch out the name and it would make sense still. So for example, the very first one where it says, you know, Tom and Linda provide lots of information, you could say support Karen by providing with lots of information of care available. Different professionals have different skills, and that could provide Karen with more information to make informed decisions. So a couple of these you could switch out, you know, switch out with the name Karen. Does the sentence still make sense? With the example, that final one, talking about respite care, if you mentioned it, Karen, and then they go on to talk about respite care, it may not apply specifically to a Karen. So you can see here, this got very high scoring, 4 reasons, 4 explanations, reference to the individual all the way through. Another 8-mark question is this one on Bill. And again, it was a very good response from a student. They follow very similar patterns as with the previous question on Tom and Linda, and you can see this was an advantage and disadvantage question. They wanted to manage Bill's health conditions. The context of the case is Bill is an older person with dementia, becoming more aggressive, and has diabetes. He has a health worker called Rasheen who supports him more specifically, and the context of the question does kind of focus on that. You can see some good things of having that multidisciplinary team, as well as a few problems that come from one. Now, doing the same approach as we did before, marking the answer, they jump straight in here. So whereas with the first one they gave a definition of multidisciplinary working, this answer goes straight in. Working in partnership has many advantages, and they are straight in with point 1. Now this answer is slightly different to the previous. With the first one, they gave 4 reasons with 4 explanations and a little introduction. You can already see here, this answer did a little bit more. They gave 5 reasons with 5 explanations. So I think 4 probably would have been enough to get good marks on this answer. So they could have, you know, potentially, if they didn't include that sort of second strength and example, this would have still been a good answer. But my kind of advice in the exam, if you're ever unsure, do a bit more. So if you're not confident with something you've said, just do another point, a little bit more detail, just to firm it up a bit. But again, as with the previous answer, clear reasons of why multidisciplinary working is good in those first 3 points, with a little explanation in each. They then give 2 problems, again with an explanation. They reference Bill all the way through, and again these references to Bill are not just dropping his name in. There are a few specific. So, I mean, the first one, you can apply the Karen test, then it works. So, you know, talk about more information, benefit the user, new techniques, procedures, medication, and in the case of Bill, leads to quicker treatments for him. Flip it out for Karen. So in the case of Karen, it could lead to quicker treatments for her. And again, that would make sense. You know, so that one's not really a very Bill specific point, but the second one is when they talk about partnership work in different expertise, such as the dietitian or the psychiatrist, to help Bill's dietary and mental health needs. You flip Bill out for Karen, that sentence won't really apply because it's a specific Bill point. Towards the bottom, again, they talk about distress, negative behaviour, aggression. They mention Rasheen. They mention Bill several times. You swap Bill out for a Karen in that final point, it won't make sense. So again, another good response. 5 reasons, 5 explanations, clear reference to Bill all the way through, and very specific ways in which Bill is connected here. So again, just a couple of 8 markers on multidisciplinary working, just to show you my approach to these is always give 4 points, 4 explanations, tie it to the character, try and explain how it supports them, how it links, how it connects. This question on the final screen here wants you to put both sides of a debate. I think it's always important to try and include pros and cons, but with the previous question on Tom and Linda, there was no pros and cons. It was all the benefits of multidisciplinary working, and that still scored very highly. So, as I say, it may not always be relevant, but I think sometimes it's always nice just to show the other side of a debate. So there we have it. Hopefully this has given you a good overview of multidisciplinary working, how it applies in the Unit 2 exam. And if you've done the coursework for Unit 5, you're probably fairly familiar with multidisciplinary working as well, because you would have done it in your P6 and your P7 of that piece of coursework. Very similar ideas, but we're just using it in a slightly different way for this exam. As always, I hope this has helped. Hope it is giving you some insights into the exam. And as always, please like, subscribe, and tell your friends. And thanks for watching.